Today, as you can see in our program, we're supposed to talk about our two important things. One, which really I feel happy, related for our research team group. Believe me, my colleagues, every time I see each research group starting to work and putting their plan, then they try to go to start the project. And some of the group, thanks God, they already publish papers. I think this is the biggest achievement. We can do it for our institute. This is a proof that the members of each research group, they are really cooperative with each other. They respect the leader of the group. I know the leadership of the research group, it is not that easy task, but I'm lucky until now we don't have any records of what we call it, conflict of research interest or disagreement about certain research project you like to start with it. And as we agreed from the beginning with the Professor Masadoumi and the team of our research, we like from our side in the administration to support whatever we can do to run smoothly for the research group to start their work. If you look for the diagram how they made it, it is again represent in the red part after 20, in the blue part out of 30, which is almost close to each other. If you look for the other course of the level 3 and 4, again with anatomy, physiology, 2-2 course between male and female. When we look for these courses, we try to see the respect of who teach the courses. Because you know, if one of our faculty, which you know them, he or she always teaching this course, always handling this course, with respect for changing of the question of the exam, which is always we talk about it. And if you remember last time, we mentioned to you where the students now, they have a strong belief that most of our faculty, they doesn't change their questions. Always take the thing, but this is not true. After we get the things, there is a lot of change, but we don't like to complicate it for our students. We like to be fair for both parts. As you see here in the other course, again, between male and female, the difference between out of 30 or 20, in the male maybe show less, 57.47. If you look for the female, again, the same thing in the anatomy, physiology 2-2-2, course. And this is the diagram again. In this diagram, it shows that after 20, performance better than out of the 30. But if you go for biology, which is the level 1 as 1-1-1 course, which is by Dr. Abdul Nasser in the male and Dr. Hanan in the female. And this is important for us because those two distinguished faculty, they teach these courses from the beginning of our establishment in the school. If you look for the second semester biology, compare male and female, and this is important for us. Again, in the male side, out of the 30, it was 48.40, but out of 20 is better. If you look again for the female side, female the same. So the course of 1-1-1 with the one exam per semester, until now, within the limitation of this data, it is very short. It shows that in the first semester 1-1-1, the fresh students, maybe their performance better than the students in the second biology course. And this is again the diagram where it will show. When we go for microbiology, which is really important for us, level 3, 2-2-3, because all of these basic science courses, if we pay a lot of attention for it and we build our students strongly, it will be easier later on, whatever their specialty, in pharmacy or dentistry or hygiene or whatever the courses. Again, here you can see in the result, out of 30 and up to 20, out of the 30 in the male side, 52.87, out of 20, 59, better. If you go to the female, the same, out of 30, 65, after 20, 3.2. This is the diagram again. When you go for the biochemistry, 211. Compare the male and the female. Out of 30 as one exam in the second semester, or out of 20. You can see not that difference among the males, but in the female side, it's make a little bit difference. I don't know if this is signals or not, because the semester record is not enough, to draw a conclusion, but you can have a guideline. But still, the difference in biochemistry between the female within one assessment per semester, compare it for the two assessment, it is, as you can see, the difference between 58.9, say it's 59, compare it with the 67, almost more than 7, percentage, which is, it can read, something different. If you look for all of the first and second assessment for the mid-semester, compare it between out of 20 and out of 30, which we applied this semester, you can see within the diagram, there is up and down. But we cannot see something, if you take the mean and the standard deviation, which is not in this picture, I cannot see there a lot of variation. So what's the message for us in the management, and for you as a faculty with us? Is our decision still under evaluation within this semester now? Because that's it. We have only one assessment this semester, then we'll go to the final. We like to do analysis for the final exam, because we change again in the way how we let the students to read and to prepare. Is the final exam, after one assessment per semester, result can be better or worse than the students if they get two assessment per semester? And this is important for us, I think, because we have a good records before, a lot of data. Since we established our school, we run with the two assessment. But the lack of data, because we're still new, when we apply only one assessment per semester. And I think this should be follow up to be evaluated again. Again, this is for the third level of the 211, biochemistry and microbiology. The same result as level 1 and 2.
Today, the chance is for four of our very active leaders to tell us their plans, the plans they have made, what they have been able to achieve, and what they expect to achieve from both the faculty research and also from involvement of students. So the chance is for them to talk. The first person is Professor Ashraf Kamel.
That we succeeded to register in the research center. Thirdly, the formation of small research groups and subgroups. And number 4, the challenges. And number 5, our future vision and perspective. Our group members and expertise, actually we are very lucky to have such wide variety of different experiences in the basic sciences, in dentistry and pharmacy. So I consider myself very lucky to be in this group. Regarding our plans and progress, when we had 3 meetings since then. In the first meeting, we just were exploring how can we go on, how can we register in the research center. So we started with the most simple proposal to do, which are surveys. And we decided to do 4 surveys and to register them in the research center, just to gain the experience of dealing with the research center and registration of proposals. And also in the first meeting, we prepared topics from each member of the group about according to his experience, what are the research topics that we can go through. And we prepared a complete and a full list containing all the researchable topics by the members of the group, and this list is already available with us in the group, and we are thinking if we can put it on the website to be available for researchers, for interns, for students, so that if anybody can find a point that he's interested in it, he can go to the respective faculty and start doing the research together. So we prepared this list, the research titles by every member, starting with myself. It's a long list actually. And then Prof. Gamal Qinawi, Dr. Abdel Nasser, Dr. Mahdi, Dr. Tariq, Dr. Fathi al-Bahiri, Dr. Muhammad Asim. So this list is already available with us, and for anybody, even from outside the group, welcome to do joint research with us. Regarding the research subgroups, this was done not intentionally, but according to the work. Small subgroups of closely related specialities already formed according to the research topics to be done. However, these research subgroups are not fixed. They can be formed, they can be changed after the end of the research, and new research groups formed after that. The research proposal registered in the research centers, alhamdulillah, we registered 8 research proposals in the research center, and these are the titles, but just for the time, I'm not going through each of them. And these are the screenshots of the research registration forms in the research center. So we have 8 research proposals already registered in the research center.
Once we receive the nomination and tasks from the director of the research center, Prof. Masodomi, we start immediately our research meetings. Our research meetings mainly concerned with implementation of the broad terms of references for the scientific research groups. In our first meetings, we emphasized that the research work should support the vision, mission, and goals of our respected institute. As Professor Ashraf mentioned, we like to reach the outstanding research. We like also in our vision the most preeminent higher educational institution of learning through the eminent research work, as well as engagement in scientific research in all health disciplines which benefit the society. Later, we start dividing the research group into subgroups, like constitution of the subgroups according to the specialty. We try to make a little bit mix between the specialty, so all of us, we can get benefit from each other. First, I would like to welcome our respected colleagues who are from outside the research group, which are sent already to us from Professor Masodomi, and they like to join us in the research group. I would like to welcome Dr. Iman Al-Wakil, Assistant Professor of Anatomy and Physiology, and Dr. Julie Rajan. We create one research email. This research email will give us a better chance to communicate together, and also we can discuss our proposals even without meetings. So we met already, but I mean this research group will gather all of us in one group so we can communicate easy together. We try, after subdivision of all the group into subgroups, we try to set a theme, just a matter of motivation and encouragement of the subgroups. For Team A, research is creating new knowledge. For Team B, scientific research is one of the most exciting and rewarding of occupations. For Team C, academic success depends on research and publications. Also, in our subsequent meetings, we sat together, we tried to arrange listing the researchable topics according to the available facilities, equipments, and materials we have. Some of our points or topics registered already in the research center, some of them under processing and registration. We have to finalize them as soon as possible. Some of the, according to the team, some of them we have survey studies, and others we have either clinical study or in vitro study, I mean laboratory studies. One of the survey studies, which is already proposed by Team C, and it is much more suitable for undergraduate research students, especially level 12, the last level of dentistry college, about their perception and awareness of the attitudes of dentistry undergraduates towards the information technology. As we always emphasized in our respected institute, to shift from paper and pencil. As we all know, we already canceled paper and pencil even in the exams. We have electronic exams, we have electronic filing of the patients. So just we want to know the perception of the students, the undergraduate students, to build the good perception, so after their graduation, they will adopt only high information technology, like the whole world now, and how we can use this technology to improve patient care. The other topic also, it will be like questionnaire-based or survey regarding the relationship between oral health literacy and oral health status among the college students. Also, this proposal was prepared by Team C. As we know, dental anxiety is considered number 4 regarding the common fear among the world, and number 9 among the intense fear. So we would like to know the prevalence of dental anxiety among the patients who are attending a dental educational institution like our institute. So this is questionnaire-based study, and it is proposed by Team C. In addition to some questionnaires or survey studies, we have also in vitro studies like the antimicrobial effect of cinnamon. As we know, all the world now go back to the nature because all the chemicals, especially antibiotics and other chemically prepared compounds, proved to have bacterial resistance as well as many side effects. So that's why we go back to essential oils, which are present in the herbs. And also, once this proposal was already prepared by Team B, in our mind to extend further studies regarding not only the cinnamon, because this proposal is concerned with one of the most important bacteria, which is isolated from the patients with chronic periodontitis with pockets, which is B. gingivalis. This study will be in vitro study in microbiology lab. However, we have to extend our study to other herbs and other medicinal plants with essential oils. As we all agree, saliva is our body's mirror, so that's why we concerned with salivary biomarkers of periodontal diseases in response to the treatment. Once we discuss this research, we found it will be much more suitable to be faculty research, and this proposal is prepared by Team C. Regarding the very active, mashallah, Team A, they proposed very important subjects. One of them survey study, and already it is registered in the research center. And the students of level 5, they already start doing the research. It is dietary and toothbrushing habits, assessment and its effect on the incidence of dental caries in the populations of Riyadh, Saudi Arabia. The other one also proposed by Team A and registered in the registration center, which is prevalence of the interdental caries in the bicuspids and molars compared to the incisors. This research is composed of two parts, which is clinical and survey at the same time, and conducted by level 10 undergraduate students. Also, we have one of our active members of research group, Dr. Dalia Abdelazim. She participates because we would like to encourage the collaboration between different research groups. As Professor Ashraf mentioned, we have to share all the experience. So Dr. Dalia, she has some collaborative researches with our respected colleagues from pharmacy and dentistry departments. Regarding the completion of the list of the basic research equipments and instruments, also we have the equipments and instruments which they are already available in our labs, either microbiology labs, even pharmacy labs. However, now we are starting to do listing of what we need, and we think these equipments which will be requested, all our respected colleagues will get benefit from them, not only our research group, all the research groups, inshallah. And we would like also, and we hope, inshallah, histopathology lab will start operated, inshallah, maybe from the next year after preparation of the all equipments. Inshallah, we will achieve a very good job after installation of histopathology lab. Sure, all of us, we are like to be supervisors because we only discussed the broad term of reference, so we would like to be supervisors of research projects for the students, and our aim for international.
From the research center last December, I tried to highlight what our mission could have been as a group. I highlighted the research proposal for a grant application and the student topics, and last the publication and with the national international congresses presentation. I chose for grants, or my interest went for a recent issue in the dentistry for a grant application proposal, which is the nanotechnology. I know that we are, as medics, we are a little bit, or we don't know much about the nanotechnology. It's a little bit sensitive for us, but it's simple as every cell in our body, in every structure, has an energy. And whenever the device of the nanotechnology that hit the nucleus of the cell in our body or in any structure, that let it exert energy. And in computer-aided program that can measure the difference between that static energy and the exerted one, so we can have an image eventually at the end for that structure or that cells, and will give us a view how it looks like this. In nanotechnology and dentistry, the European Journal of Dentistry in the year of 2013 have summarized that have been tried before in the field of nanotechnology. It had been tried in the dental implants, nanorobots, composites, and periodontal drug deliveries, and so on. But again, my interest went to prevention of dental caries. And there was good detection by the nanotechnology for inability of remineralization of early enamel lesions. Why this technology could be visible for us in Riyadh colleges to do? Because there is a chair in King Saud University having all the devices that we could have used, and one of them is the nano indenter, which I need for this research grant application. And they have to present at the end of the year some graphs and figure for sharing in researches and publications. I had the privilege in last 3 weeks to be in or visit the general session of the IADR in Boston, United States. And whenever I go, I'm trying to submit as observer in the American Dental Association working groups. The working groups, they have so many disciplines, but one of them is the toothpaste. I register as an observer. I have right to share in discussion, get the newsletters and so on, but I have no right to vote. And I looked for the new stream of research going in the direction of putting additives for the toothpaste. Whenever the caries is becoming more aggressive, whenever there are more trials for the toothpaste, which is consumed by millions around the globe to make it more efficient. And now a new stream of research is coming for combining the fluoride with the arginine. Arginine, that's a substance newly developed for producing alkalinity inside the oral cavity, making the saliva more alkaline and suppress the acidity. That will be very good, especially in our region, I believe, which we suffer from the pH acidic so high, especially for children and adolescents. We get early demineralization, and due to soft diets and confectionery, Coca-Cola consumption, and so on. And a lot of study raised up even from Saudi Arabia about the relationship between caries and the pH values. So my proposed research for grant application will be the comparative nanohydroxyl apatite mineralization potentiality by combination between the fluorides and the arginine in the initial enamel lesion as in vitro study. But whenever we can get possibly positive results out of that, we can go for a clinical settings. I hope this. And the methodology for the study will be as simple as just extract the teeth, and we can just expose it to the pH cycle, but as long as 60 days. I like the biofilm to be built up, and then through a natural donated saliva and incubated, and then brushing by simulator. And then at the end, I can look for the depth profiles through the nanotechnology, and I'm wishing to get a good picture which differentiate between the normal electron microscope or optical microscope, nanomicron and megamicron like this from different parts of the teeth. I don't know how much the appreciation could have been from King Abdulaziz Foundation for a grant application. It is medical study, dentistry, and enamel. But my target will go also for something outside the kingdom, which is the National Institute of Craniofacial Researches. They have a category for non-US based researches. And why our chances could be good for this? Because arginine, that's in the good hands of Colgate. It's produced now in the markets worldwide as an anti-sensitive agent. But when I speak about Colgate, it's as if I speak about General Motors, Ford, and so on. So it's something national in United States. And we all know the Americans. They don't pay $1 unless they see back benefit out of this. So I wish that we can get that grant for. For our second mission, which is the collaboration between the staff and the students and the interns about, we are in the discipline of epidemiology, health services, and health education. Some very interesting topics have been raised by my colleagues, like from Dr. Muhammad Abdul Basir about the dental erosion, injury, oral mucosal lesions, and so on. But these topics have been discussed or researched long time ago here in the kingdom or in our region, but not in the format which the WHO like to have it. The WHO like to standardize the way of inspection or information together to compare nations, to compare communities and alarm for that or give a green light. That's no fear for the nations. Other interesting topics from my group, which Dr. Ahmed Khashaba, he's going for the Saudi athletes about the magnitude and fears and knowledge and so on for the Saudi athlete. Already he is engaged with negotiation with some sport clubs here, and I hope by the next semester we can start something active for that. Another good topics have been proposed by Dr. Shahid Sheikh about the immune deficiency factor with periodontal health and the awareness from TB and the extent of the disease here in the kingdom. And last, I think some of these researchers have been already registered in the center, the research center regarding research challenges among the health professions and so on by Dr. Shahid.
The scope of the research of our group, Group 1, Health Promotion, Behavioral Science, and Public Health Research. The scope includes epidemiological and health services, health education, access to healthcare facilities and care, oral health, public health, and community services. These are the valuable members of our group. Some of them have been invited to join the group, and some of them they wanted to join. And this is Dr. Abdul Basir, Dr. Bet, myself, Dr. Sahar, Dr. Salwa Waziri, Dr. Isra, Dr. Rahaf, Dr. Abdurrahman Safan, and Dr. Sara Mubaraki. Regarding the progress of the research, the group that has been done until now, we have conducted around three meetings have been done. And as mentioned by the other colleagues, the first was just forming the group and knowing the interests. So each of them presented, in the second meeting, they presented their area of interest and whatever, they brought their research topics. And then we had a free discussion about who would like to join the group. And then we made subgroups depending on the interest of each of these topics. These are some of the research topics, and the investigators have already been decided. Now we are in the stage of forming the research proposal. This is one topic, oral health related quality of life among 12-year-old school children by using this questionnaire. And this will be done during the community visit, and these are the investigators who will be involved. Another topic is a comparative study of oral hygiene habits and drinking water in Sharqiya province versus Riyadh in relation to dental calculus accumulation. The chief investigator, Dr. Rahaf, and the others who will be involved in the clinical research. We have some interns who have already registered for this research. The third topic is self-reported oral health quality of life among the school teachers and parents in Riyadh. The perception and knowledge of biostatistics among dentists. The oral health related quality of life among intermediate school children by using the questionnaire. Self-assessment of essential skills among undergraduate dental students and interns of Riyadh colleges. And perception of e-exam among the students of Riyadh colleges. This is the basic time frame that we have put ourselves. After we got the notice in December, we started off in January. So the research planning, the first 2 months, now it is in the stage of proposal writing. And data collection, we have given 3 months, and then the data analysis, the manuscript writing and publication. So this is the 1-year time frame that we have organized for our research, and we are hopeful that we could complete it successfully.
Audio Jungle.